Noon, evening. Not sure where we are now.
It's just a blur at this point.
Right. Thank you all for your endurance as we go through here. Grecia Marquez-Nieblas, I'm Senior Manager at Fullwell. We're an organization that advocates for local, state, and federal policy that promotes health, justice, and sustainability. We're also proud to work with Nourish California to advocate for the CalFresh fruit and vegetable EBT pilot program's continuation and longevity. I wanted to thank Assemblymember Alex Lee for his leadership multi-year in making sure that continuation of the program exists, as well as the members of this committee and your colleagues who are not here today for prioritizing healthy food for families in last year's budget. Without that, there are tens of thousands of families who would have had millions of dollars less across the state of California to put fresh fruits and vegetables on their tables during the holiday season. And that wouldn't have been done without all of you. I also would like to thank our partners at CDSS and OTSI because they have put in so much work, not for one implementation phase, but two of this program, and it's made it incredibly successful, as was mentioned. I won't dwell on what we already know. We know CalFresh is one of the biggest impacts on hunger in our state. We know that the need to continue supporting our families is there. And we know that this program is incredibly successful. In January, before the program ended on the 31st, over $3.3 million were put directly into the pockets of Californians across the state, as far north as Mendocino County and as far south as Calexico, California, where my family lives on both sides of the border. Over 67,000 households were able to benefit at 90 locations across 42 counties, representing more than the counties where the grocery stores and farmers markets are currently operational. That includes many of your districts and the districts of your colleagues. I will say, since the program ended on the 31st, we have heard already folks are feeling it. They're feeling this as a cut to their budgets. They're continuing to feel it, and they're continuing to ask, when will it be back? We want this program back. And so all of that and what we've seen so far, even with the difficulty adjusting some of the estimates, we are excited that Assemblymember Alex Lee is asking for that $63 million in the budget to bring the program back. I want to put a fine note on what that $63 million would do. That would multiply the impact of this program, both in time, allowing it to operate continuously for 12 months, which is incredibly needed by our families who have struggled with the start and stop, but also for our grocery retailers, many of which are small and medium scale mom and pop grocery stores who are committed to this program, sure, for finances, but also because they're committed to their communities and they see the need in their communities. And for continued impact to our agricultural economy. Farmers and producers, distributors have told us that grocery stores, when they're offering this program, are ordering 2, 3, sometimes 4 times as much produce as they would when they're not offering the program because people are buying it at that rate. And this would impact also communities because there is potential for a small expansion to communities that haven't been able to offer the program so far because we know that it's needed and folks are asking. And so just to paint the picture, this also, $63 million also means more moms will be sharing stories like the ones we've heard, that they're able to buy fruits and vegetables for their kids to try, that they would have worried about buying because they weren't sure if they would have it in their budget. It would also mean that folks, like those who have actually testified at hearings like this, will come and say, you know, they're able to treat their diabetes, their high blood pressure, because they're able to buy the fruits and vegetables that their doctors are recommending to treat their health-related disease, their food-related, diet-related disease. And I think really important to consider as we're looking at continued difficulty in the budget, as we're looking at the federal challenges, and as we're weighing the cost of investing in a program like this, the infrastructure is there. This program can very quickly restart. We saw that already this fall, where from the moment we were told the funding is there to the moment it restarted was a couple of months. People started earning that money right away. It made a difference. And with the $63 million budget, over 98.5% of that would go back into families' pockets. Not eventually, but soon, very, very soon. And so I come to you with urgency. The program is done for now. We hear from families every day, and so do our grocery retail partners. We have something good. We have something that has been proven to do what it's intended to do, and the infrastructure is there. And really what's keeping us at this point is the funds and our commitment to continue supporting families in as many ways as possible, especially right now. So thank you so much.
Thank you very much. Department of Finance.
Emily Marshall, Department of Finance, no additional comment.
LAO.
Sonia Schreiger-Russo with the Legislative Analyst Office. As mentioned by others on the panel, we are also anecdotally hearing from food banks that demand is high on the fruit and vegetable pilot. Of course, we've also heard from counties and local organizations that the program was very popular, which is likely reflected in the speed of the expenditures of the funds that have been allocated to the pilot thus far. So we are happy and willing to provide any technical assistance that might be helpful if these are programs that the legislature is interested in expanding or extending timeline-wise.
Thank you very much. Questions from committee members at this time on this item? What do you believe is the main cause of growing food insecurity?
That's a great question. Thank you. Multiple factors, right? People, I think, are really struggling with the cost of living. Compounding factors like the cost of housing, healthcare, childcare, all of the issues that we heard about today really impacts people's food budgets. And so, but you have to eat. And so what do you do when you have children to take care of that you need to feed, and you also need to pay the rent, and there's all of these compounding factors. We're really grateful for, like I mentioned, multiple programs that help to support people with their food for folks that are eligible for CalFresh. That's a tremendous resource. But as I said, we know through data that people run out of those benefits by the end of the month. They just don't last the whole month. I think for anybody in this room that has been to a grocery store recently, I think we feel it viscerally right now. A great example is the cost of eggs, right? That's been in the news a lot. So I think it's all of those factors that are compounded. And also, post-COVID, a lot of the temporary supports that were in place are now gone, right? And so with those temporary supports gone, people are feeling those strained economic factors even more.
Yeah. What is the main food bank that would serve the community of Altadena? Do you know?
Yeah, that would be the LA Regional Food Bank.
So it's the LA Regional
Yes.
Food Bank still?
Mm-hmm.
Okay.
Yeah, and I don't have those particular numbers right in front of me, but I can get them to you in terms of what their funding cut would mean. I can share, I have the numbers for
Were any of their facilities affected by the fires?
I don't believe any of their food distribution, like their warehouses were impacted, but I do believe that some of the community partners that they partner with for food distribution programs were. And like I said, they have reported a 60% increase in people that they're serving compared to the same time last year.
Yeah, I plan on doing a listening session out there in May in Altadena,
Wonderful.
so I would love for you to connect with my staff.
Perfect.
Because I would love, while I'm out there, to visit their facilities and understand their work a little
Absolutely.
bit more.
And I can also just quickly share, if you wouldn't mind, the Feeding America Riverside San Bernardino in your district would go, with their CalFood funding, would go from currently receiving about $2.2 million per year down to about $260,000. And so just to kind of put that perspective on local impact for you as well.
You're good. Good job.
Prepared.
Enough stalling, Assemblymember Lee.
Well, thank you for stalling for me, Mr. Chair. Thank you so much for agendizing this item for the EBT pilot project. I was obviously very interested in making sure this program stayed alive as long as possible, given the related legislation I championed and the several budget asks, and now we're trying once again with another $63 million. One of the big setbacks to this program, unfortunately, has always been the start and stop nature of it, is that we were able to put together a couple of different $1 million, and we're able to service thousands of families, but only for a short, limited period of time. This last time was basically just over the holiday season, and then it stopped and cut off. So I just wanted to ask the department a little bit about, since we have the intermittent funding that led to the start and stop, what impacts have you seen about participating? What impacts have you seen with participating retailers and CalFresh families? If you've received any feedback or information from folks, because in that stop and start nature, we have kind of imperfect pilots. because it's been so short, but I just want to see if you had any feedback or you had seen or heard about the stop and start nature related to that.
So on our side, we are not directly connected to clients that are participating, so it might be more appropriate for you to highlight some of what you shared in your testimony.
Absolutely. I think if we're talking about sort of different folks, if we're talking about families and participants of CalFresh, we've gotten resounding positive feedback. It's been both popular because folks are using the program, but folks have said that this has helped their families have more money for food. It means that they're buying more fruits and vegetables as well, which is impacting their health. And many of them have felt like this increases their overall budget. It's just having this extra up to $60 a month, even though on average folks are earning only $49. And so it makes a really big difference just at the individual level. For our grocery retailers, many of them have shared that there's customers coming in to their stores that have never come to their stores from different racial demographics, different backgrounds, different ages. One of our partners down in Southern California, Mother's Nutritional Center, primarily has worked with families who have WIC and use CalFresh, suddenly saw an uptick in seniors who were visiting because they were offering the program, and they are often on a much more limited budget. And so for the retailers, great to have more folks come in, be able to take advantage of the program. The downside is that, yes, as the start and stop happens, folks are not, individual families and CalFresh participants have told us it's difficult for them to budget when they're not sure how long the program's going to be active. We've done a lot of proactive messaging to try and let them know, especially this last time, that the program would be through the holiday season. But that's a challenge for them because even if it is a couple of months, they have to budget longer than that. And many times they're budgeting a month or 2 months in advance. Similarly, for our retailers, it's been great for them. They've been able to buy a lot more produce, sometimes 2, 3, or 4 times the produce that they normally would buy in a week to be able to meet the demand. And then they're having to tell the producers, who then have to tell the farmers, sorry, I know that was 4 months of lots of buying, and now we can't do that anymore. And we're not sure when we're going to have to do it again.
And that was difficult for the retailers and the producers because they didn't know when it was going to end. I mean, we started the first time we weren't quite sure when it would end. I know this last tranche where we only did the 3 months, we kind of more so predicted because we had some data to do that, and that is very hard even on the food chain itself to be like, to your point, we were buying a lot in this month and suddenly we got to ramp down. So that is difficult. But I'm glad that it had enough of a tangible effect on those food chains, on the retailers, that it actually led to more increased participation. Because in the larger context, right, as even our agricultural industry is suffering under the Trump administration, and especially with all the cuts that are happening there too, we want to also incentivize more people eating and buying produce that is grown in California as well.
Yeah. Absolutely.
And I also wanted to ask the department is that, given there's a lot of interest from this subcommittee about trying to revive this program as long as possible, if we're able to appropriate money to have maybe a 12-month period, could you reactivate the program as quickly as you did last time, where in a turn of a dime you could have it reactivated for CalFresh families?
So there are some challenges on the department side with the start and stop as well. It is not a light switch, right? It does take some work on our part, but I think we would be able to do it. I did highlight in my comments that the pilot is a great proof of concept, but if we were looking to make this a more permanent program, that we would want to consider some more significant infrastructure, both in terms of the technology and integration with our eligibility system, as well as staffing for retailer engagement, and to ensure we have, equitable geographic spread across the state, for example. So I think if we were looking at something more permanent, we would have some technical assistance to provide on what would be needed.
Yeah, and that actually leads me to my last question about, your department is scheduled to give a report to the legislature by July 1st on the evaluation of the program. The way it was set up, mostly how it was done the first time. And I think those are some good recommendations there. Do you think before July 1st, given that we have to finish the budget in June, that the department is able to share with us at least some previews or highlights of said report, because that at least can help us in real time think about things like that, those considerations, because right now we're really working on the limited information that we know from our own attempts to do this, but I think there's a real effort to try to uplift people out of poverty, but also provide them nutritious food and have all these multipliers across the economy. but we also want to have the formalized, real effort to do it by our own budget deadlines. So I'm not saying right now you have to share all those recommendations, but I'm just saying is that ahead of that, I would really appreciate if there are some highlights that you could share with this committee so that we can work on the issue in the budgetary process.
So we're definitely tracking the request. I don't want to make
Yes,
promises on behalf of my staff who are working on the report, but hearing the request, and we'll do what we can to get you the reporting.
Right. And I'm just saying is even those high-level suggestions you just made, those are great ones, and those are things that we would need to keep in consideration as well. So as we tailor this proposal with the relevant budget subs in the budgetary process, definitely the more feedback, the better. So
We're available for technical assistance, always.
thank you. And I want to thank the chair for a masterful stalling as well. Thank you.
That's what I do. All right. Thank you so much for this panel.